And if you don't mind, could you also share about your journey as a plastic surgeon and how has it been shaped?
Yeah, so basically it is a long journey. Yeah. So after standard 12, you get into MBBS. MBBS is a 6-year program, almost 6-year program, 5.5, 6-year program, 3 years of general surgery, 3 years of plastic surgery. So a minimum time anyone in India who will take to become a super specialist doctor, MCH or DNB plastic surgeon is a super specialist doctor. A minimum time it takes is 12 years. Yeah, that is if you keep on passing all your exams in the first go, and you get the seat of your choice in the institution of your choice in the first go. Minimum time it takes is 12 years. So I did my 6 years of MBBS. I was lucky enough to get into a 6 years direct plastic surgery program at Ganga Hospital, Coimbatore, which is one of the best institutes in the country. There was a lot of high volume work there. It shaped me into what I am, and I really thank all my gurus and my colleagues there to have really helped me to reach here. Following which, I went into my cosmetic surgery training, which itself was a fellowship program. So after your degrees, you get into subspecialties and fellowship programs, which again was around a year and a half. So almost 14 years of training into me getting into becoming a cosmetic plastic surgeon, following which I start my practice. So that is how it is there, and almost 8 to 10 years into practice now. And if you want me to give some advice to a young guy who wants to get into the field of aesthetic surgery or plastic surgery, is that don't take shortcuts. Please do all your programs fully and completely. People I see even after MBBS want to get into the aesthetic field. People after dermatology want to start doing surgeries and all. Do your qualifications and do what your qualification allows you to do. Now, an important thing is these are also litigious times. There are a lot of litigations being happening left, right, and center on all and various professionals, and you don't want to get into that area. So, if you are interested in doing what particular thing, then take all the degrees related to it and then do it. Don't try to take shortcuts. It doesn't work.
It totally makes sense. Like taking shortcuts in general in life does not work.
People think that it is easy money. शायद अगर उनको ऐसा लगता है nothing is easy money. It is easy money. चलना यार MBBS के बाद मैं ये aesthetic treatment चालू कर देता हूँ, dermatology के बाद surgeries चालू कर देता हूँ, या whatever. These are my views. Whatever people think as a shortcut, and if they take it somewhere or the other, you'll realize that you better had not taken it. And do all your training before you get into private practice. Finish all your trainings, and then of course you do your workshops and you keep going to the conferences and keep updating yourself. That is a different issue, but primary education you finish before you get into private practice, and then you start what you are trained into doing.
And totally makes sense. And you also mentioned AI, that it can improve the skin tones, editing, and all of that. Has AI played a role in your field? Has it?
Yeah, so see, AI, robotics, instrumentation are very important when used properly. There are there are a lot of devices. I would start from devices: laser liposuction, RF tightening devices, the various saws which can cut the nasal bone without causing damage. All these are beautiful instrumentations which have come into our practice, which we have adopted. We are one of the few hospitals in Gujarat to have a lot of advanced technologies which we use for our patients to give surgery. So this decreases the healing time. It increases my precision. It gives a better defined result, and it has surely helped my practice. And this is the way of usage of a positive technological use to give better result. One more thing is, like, various softwares are there wherein you can show the patient even before surgery how your nose is going to look or how your breast is going to look. That I use with a lot of caution, because sometimes it can give you unrealistic images and the patient might have that image, and then the surgery will do a little different thing. So that has to be used with a lot of caution, depending upon how your patient is. If your patient is a chill guy who will understand what you are saying, and there are little plus minuses to technology, then that is okay. But someone who is really fixated on point things, don't use those softwares. And AI similarly, use all these things in a way that it helps you explain people, makes it easy and explain the results and this thing easy in a better way, so that they are able to take informed decision.
So, Doc, what we've seen is that you are fairly active on social media. You're very out there. You're giving out value. In today's time, how much do you think for a doctor of any level, be it a beginner or a very elite person, how important is it to be active on social media and to actually give out value?
I think it is very important. Yeah. See, it is your outreach. See, you are able to reach people who come to you. That is one thing. A person comes to you, you consult and you talk to him and his family. It is very less amount of people you can influence directly. See, social media has given a very good platform if used wisely, which of course any doctor will do. He can reach many people without even him knowing where he is reaching, and give the right information. See, there are already people out there who are anyways giving wrong information. So more damage has been done to the world because the right people have not stood up for the right reasons, rather than the wrong people doing damage, is what I believe in. So the right people must go out on social media. You don't need to be like making one reel a day and be crazy, and so that it affects your practice and it affects your mental peace. Because yeah, social media is a double-edged sword. A person can give you a good review and the same person can give you a bad review, and then it is crazy. Yeah, we deal with a lot of stress every day anyways, surgical stress. So you don't need to take this as an additional stress, but yeah, keep it in your mind that it is a good way in which you can reach your audience. You can tell what you are doing, what works, what you are good at. You are telling what you can do. You are not comparing yourself with anyone and telling that भाई ये खराब कर रहा है या ये वो कभी नहीं करना है. खुद का काम करो, खुद का देखो, खुद की लाइन सही है ये बताओ, and give the right information to the people and then let the people choose. But someone has to be there who constantly gives them the right information and keeps them updated about whatever is happening. So social media and any doctor, the junior most to the senior most doctor, being present on social media, I think is important.